Hi, I'm Dr. Tom Hendrickson, and I want to show you one of the techniques we use in Hendrickson Method for carpal tunnel syndrome. Carpal tunnel syndrome describes a condition that's a compression of the median nerve as it comes through an area of the wrist here called the flexor retinacula that covers the wrist. It tucks under that thick tissue with the flexor tendons, and that nerve gets compressed, leading to numbing and tingling in the thumb, index, and middle fingers. I want to show you how we can simply treat that. So we're going to, first of all, do some muscle energy technique. And the thenar and hypothenar eminences, the muscles that are defined in these pads here, interweave with the what's called transverse carpal ligament or flexor retinacula. So we can lengthen that by doing some muscle energy technique. First of all, I'm going to fold the thenar and hypothenar pads together. Then I'm going to try to pull them apart, and Luke's going to resist me. So go ahead and resist. So as he does that, we're engaging, we're tensing the flexor retinacula. Then, as he relaxes, I'm going to stretch these thenar pads apart. So I'm pulling them apart. And then we're going to do that again. So I'm going to try to pull them apart, and Luke, you resist. So hold them together, and then relax, and then he's relaxing, and I stretch them. So this is a way to lengthen the flexor retinacula. In chronic conditions, we also want to do some soft tissue mobilization where this retinacula attaches. So it attaches here, this bone's called the pisiform bone, and then about 1 finger width toward the palm, there's a little bony protuberance right here, I can feel it, called the hook of the hamate. And then over here, if you were to put your thumb on this little, what's called the snuff box, there's a little hollow right at the base of the thumb, and you put your thumb there, and then you try to touch the tip of your thumb. I put my finger on a little bony protuberance called the tubercle of the navicular, and then about 1 finger width distal to that is the tubercle of the trapezium. So these 4 bony landmarks are the attachment points of this retinacula that thickens and compresses the nerve. So what we want to do, since the ligament or this retinacula is going this way, we want to go transverse to the line of the fiber. So I'm going to go right here at the medial side of the pisiform, back and forth. Then on the hook of the hamate, back and forth. This is dissolving adhesions, reducing the restrictions. Then I go to, on this side of the hook of the navicular, and then on the side of the tubercle of the trapezium. Back and forth this way to open this up. And this releases the tension or the compression of the median nerve, and very effective for carpal tunnel syndrome. So those are one of the techniques we use in Hendrickson Method for the carpal tunnel.